I'll pass.
Okay, Senator Kennedy, it's your turn to ask a question to Mr. Romney.
When, Mr. Romney, are you going to tell the people of Massachusetts which health care program you favor? We had 8 or 9 different programs that Democrats and Republicans had introduced in the Congress and Senate in the last session. We had a number that were introduced by the Republicans. When are you going to tell the people of the Massachusetts which health care program that you're in favor of and why you're in favor of it? And if you're not prepared to tell us tonight, maybe you tell us when we're up in Holyoke in 2 days from now.
Mr. Romney.
Well, I'm happy to tell you which one I come closest to. There's no one that
Which one do you support?
I'll tell you which one I come closest to supporting, and that's the one of Senator Lloyd Bentsen, which was introduced in 1991.
That's not health insurance reform.
Which was a start.
That's
which is a good start. Which is a good start, and which is something which I think this country needs. I go across the state. I see 600,000 people who don't have insurance. I want universal coverage. I want everyone in Massachusetts and in this country to have insurance. I think we ought to start by saying we're going to have portability. We're also going to make sure people can't be denied on the basis of pre-existing illness. We need to have a subsidy. That was not in his plan, but a subsidy for those people who are low income and can't afford insurance. We need to make sure that all people, not just corporations, can deduct on a tax basis the cost of their premiums. We also need to make sure that there's not discrimination in rates between big companies and small companies. All of these things, I believe, are a first step to reaching universal coverage. I also have a plan bringing down the cost of health care. I've worked in health care much of my life as an investor in the industry and also as a consultant to the industry to learn about it, helping hospitals become more competitive. I have a plan. I have a position paper on health care. I'm happy to show it to you, Senator, anytime you'd like. But I don't understand why you didn't support Senator Benson's plan in 1991. We'd have had more people covered today.
Senator, Mr. Romney, it isn't a question of showing me your paper. It's a question of showing all of the people in here that are watching this program the paper.
Well, they ought
to have an opportunity to know what is the cost of your program.
I don't have a cost to my program.
You don't have a cost.
Okay. No, I'm sorry. I don't have the congressional.
I
don't have the congressional budget
office. Do you
office.
have any other estimates?
I don't have the congressional budget office that goes through and calculates the cost of my program. As it did for yours, the cost of your program was billions of dollars in additional deficit. I am not in favor of a program that will add to our taxes or add to our deficit.
Well, what is the cost?
Ladies and gentlemen, please.
What is the cost of the tax incentives on the deficit?
I'm sorry?
What will be the cost in terms of the tax incentives that you provide? What will be the impact of that on the budget?
Well, the impact, I do not know the specific number
so
of the impact of that
on
the budget, Senator Kennedy, and I think it's a wonderful idea to take it through piece by piece. And
that's what you have to do as legislator.
I understand,
that's exactly what you have to do as legislator. That's what I had to do in getting the report.
Senator Kennedy, I understand your position. I'm happy, and I have a position paper on health care. I do distribute that. Don't say to people, gee, you can't get one. We do have that. We distribute that. I have health care professionals for Romney who've been working and have helped work with me in that position paper. But let me tell you, Senator, I do not believe in the type of employer mandates which you placed upon your plan. I do not believe in a government takeover of the healthcare system, which was part of your plan. I don't believe the American people or even a Democratic Congress were willing to accept a government takeover of a healthcare plan. And that was the error I think you made.
I would just point out that everyone on Medicare better be concerned, because that is a governmental program. The 350,000 veterans that are getting medical benefits in Massachusetts, that is provided by the Veterans Administration, and evidently you have some difference in Social Security. Why is Social Security all right, Medicare all right, and veterans all right, and trying to provide a shared responsibility like we have for the United States Senate and the federal employees? Why is that wrong?
I think it's a wonderful idea for people to have the choice of being able to purchase different plans.
Well, I do not think
it's a good idea to have the federal. I do not think it's a good idea to have the federal government take over our healthcare system. I don't think it's a good idea for the federal government to place global budgets on a state to say how many teaching universities we're going to have to teach medicine, how many students get to be in which specialty, how many get to be general practitioners. I don't think it's a good idea to have price controls set on the economy and on that major part of our economy.
Do we have too many specialists now?
Do I think we have too many specialists now? You know what?
Do you or not?
Senator, let me tell you something. I don't think it's the. Let me tell you. Do I think so? Yes. Do I think that's relevant? No. Do you know why? Because the free market economy is the best at setting how many specialists we have, not some bureaucrats in Washington.
We have just had 6 exciting minutes on health care. Mr. Romney, your question to Senator Kennedy.